The Sports Minister, Nigel Adams, speaking in the last hour. More now on the report from the Care Quality Commission, which says a perfect storm of increased demand and staff shortages means that people with learning disabilities in England are still being locked up in unsuitable, secure units. The report also warns that more than half of England's accident and emergency departments are not good enough. The Department of Health and Social Care has responded by saying that it's committed to providing everyone with the best quality care. Well, Duggan, Chief Executive of the Mental Health Network of the NHS Confederation, which represents NHS mental health service providers, joins me now via a webcam. Thanks for joining us and good afternoon. Why is this proving so difficult to sort out?
Good afternoon, Sophie and the viewers, and thank you. It's proving difficult because it's a fairly simple factor that mental health and learning disabilities have been the area that has been underinvested for many, many years. I've been in the services for decades, and it does go back a lot of years. We're now trying to address that. We're in the middle of a 5-year plan. We're about 3 years into it. Money is starting to get into the services, both mental health and learning disabilities. That money will be used for quicker access, to have people treated and cared for nearer home. So what this report is showing that we're nowhere near there yet.
Well, it says more than that, though, doesn't it? It says that actually services and the quality of services is deteriorating.
Yeah, so as always with these plans, it takes time for that investment to get in and to get properly established in the services. It is starting to reassure people. It is starting to happen, but it will take a good few years forward. I mean, the most important thing is that we are confident that further money and investment will go into the services over the next 5 years. Otherwise, we won't address this particular issue. And all the mood music is that that's going to happen. The other massive factor, Sophie, is workforce. Are we going to have the right people to deliver the care that we want to in these plans? That is a real challenge. For the providers that I represent, that is one of their major challenges, to ensure that the nurses, doctors and therapists are all in place. We also need, for workforce, we need to think very creatively and work with schools and other factors to try and get people into mental health services.
But this is, as you say, this is a long term. I mean, this is years you're talking about, and the frustration for the families is palpable. We heard from a woman a short time ago whose son was 200 miles away. She said he was being held in a seclusion room, locked away for 4 months, and she is trying to get him back home to be supported in the community.
Yes, so these are totally unacceptable cases, and we have to start taking those out. We can't accept that as we go forward over the next few years. What's required, as I've said, is proper investment. And also, it isn't just the mental health and learning disabilities providers that can solve this. It has to be done with education, the voluntary sector and the independent sector, all sectors working together closely. Actually, that is happening. Because in mental health and learning disabilities, it's very complex to provide the range of treatments that's required. It isn't about medicine and medical care. It is about social care. So I have to say, the one big threat we've got going forward is if we don't get some money into social care and local authorities, that's going to make the plan 100% harder to implement. So that's another part.
This isn't just about money now, is it? Because it is a relatively small number of people we are talking about. I mean, it is more about the organisation and delivering, and as you say, the lack of skills that staff who are treating these people have.
So it's about money and it's about the workforce. Of course, it's about management and leadership. And, you know, I have to say that some fantastic, really incredible managers and leaders locally trying to put this right. It is hard. And it gets back to the fact that this particular area has not had the attention that has been required over the years. And that's caught up with us. However, we will be able to put it right, but it will take a little time longer. And yes, you're absolutely right. It's all factors, because it's a complex problem, and management and leadership is an issue too, which is being addressed.
Duggan, we'll leave it there. Thank you very much.
Thank you very much.
The headlines on BBC News.